What if the key to blindness wasn't a 30,000 pound device? It wasn't tucked away in the back of a specialist hospital or locked behind a paywall of privilege. What if it was this, lighter than a stethoscope, smaller than a pen, and affordable enough to be used anywhere on earth? This tiny device is quietly transforming eye care across the globe, from high-tech hospitals to rural clinics miles away from a power outlet. But where did it come from? Who created it? And why does it matter now more than ever? Today I would show you how a simple solar-powered device is making a massive impact, and I'm joined today by someone who helped make it possible.
Hi there, it's Andrew Blaikie from the Arclight project. I'm an ophthalmologist based in NHS Fife in Scotland and University of St Andrews, where I'm senior lecturer and the lead for the Arclight project.
My name is Saad, I'm an ophthalmology trainee here in the UK, and this is Arclight, one of the most innovative and powerful pieces of eye care equipment I have come across by far. In this video today, I will break down how you can use an Arclight, exactly how this device works, and why it's helping reshape clinical practice in ophthalmology all around the world, especially in low resource settings. And I'm incredibly honored today to be joined by Dr. Andrew Blaikie, consultant ophthalmologist, global health leader, and one of the key co-founders, co-creators, and innovators behind this little device. He'll be sharing with us the story of what inspired the creation of this device, the global impact it's having right now, and why this little tool might just change the way you think about eye care. So let's get started. There are over 2 billion people in the world with vision impairment, and at least 1 billion of them could have their vision preserved or corrected. But many simply don't even have access to simple measures like glasses or surgeries like cataract. A standard direct ophthalmoscope, which helps one examine the eye and look into the back of the eye, costs around 200 to 600 pounds. It requires consumables, power, maintenance, and the main thing is it is often not available in low resource settings where the need might be even more. The solution? The Arclight. It is a solar powered compact ophthalmoscope and otoscope, and it fits right into your pocket. When you first get an Arclight, you will notice many things in the small bag in which it comes. So the first is the Arclight instrument itself. Second is a nice handy little stand which you can use to mount the Arclight onto your own mobile device to take pictures or further video what you're doing. There is a nice little handy quick start guide which I will show you right here. You also have a near vision reading chart along with some pinholes, Amsler grid, and other tests which can help you examine the patient on the go. You also get a measuring tape, 2 different sizes of ear speculums, USB-C charging cable, a lanyard, and a bedside visual acuity testing chart which you can use bedside or 3 meters away from the patient. All this comes in this nice box which you can carry with yourself anywhere. As for what you can do with the device itself, you have a magnifying loupe which magnifies what you're seeing. So let's say you want to examine the anterior segment of the eye. This is what you could use. You have a direct ophthalmoscope on the other end of the device which you switch on, and you look through the tiny peephole, and using this you can look at the back of the eye of the patient, fitting right in the palm of my hand. You have the solar charging cells. You also have a USB-C port charging area, measuring scale, red box here to check for red desaturation in patients. You also have an accommodation target for the patient to look at, and you have a pupil measurement gauge grinded into the side of this machine as well. And then you have a white dot which can be used as a fixation target. This is mainly from the ophthalmology perspective, but you could use this device as an otoscope as well. So you would take your otoscope speculum and you will fit it on to the loop side. You will switch on the light. Here you go. You now have a portable otoscope. Another important thing is there are various light functions. So if you click the main button twice, you will see that we now have blue light which can be used to visualize any corneal epithelium defect after you have stained with fluorescein. You also have a blinking light there which can be used as a fixation target for children or those easily distracted. It charges directly via USB-C port, or it can also be charged with the sunlight. So with low resource settings, that becomes particularly useful. Even if you don't have any electric outlets nearby, you could just charge it using the sunlight. Speaking to you about the scale of how this Arclight is changing global eye care. More than 50,000 plus Arclight devices have been shipped and distributed worldwide, from war-torn refugee areas like Ukraine to Tanzania, Kenyan slums, Uganda, Malawi, Zambia, Pakistan, and very recently it has also been rolled out to the United States of America. The Arclight has also been recently included in the newborn screening guidelines made by the WHO, where the direct ophthalmoscope bit of the Arclight is useful to examine the fundus of newborns. It is a very versatile instrument. It is used by soldiers, frontline clinicians, rural healthcare workers, medical students, anybody who is interested in having a look at the back of the eye and even examining the front surface and anterior segment of the eye. And it is so much more affordable and so much more cheaper than your standard fragile ophthalmic instruments, which are so expensive to own and to break. Now, I could talk all day about the design of this device and its impact on global ophthalmology care, but to truly understand the heart of the device, you need to hear it from the person who helped bring it to life and is the champion leading forward the Arclight project. Dr. Andrew Blaikie is not only the co-creator and the innovator behind the Arclight, as well as being the clinical lead of the Arclight project. He's also a passionate trainer and a senior colleague of mine here in NHS Scotland. He spent years combining clinical practice with global outreach, with one clear mission: to make eye care accessible, sustainable, and scalable in the parts of the world that need it the most. Dr. Blaikie is answering our questions today from one of his most recent global outreach trips to Zambia, where he was actively involved in training the healthcare professionals in the field on how to use Arclight to create lasting change in their communities. So Dr. Blaikie, first of all, what inspired you to create the Arclight?
The Arclight project is inspired by the need for effective but low-cost training and diagnostic tools in low and middle income settings, where the burden of needless disability from blindness and hearing impairment is most pronounced. So around 10-12 years ago, we started work on developing a low-cost but effective Arclight device, which is a combined ophthalmoscope, anterior segment loop and otoscope for diagnosing eye and ear disease. And so this week, in fact, we're in Zambia training general clinical officers from all over the country to use the device to examine and diagnose and manage, as well as refer on, eye and ear disease.
And my next question, what impact has it had globally?
So the impact so far has been great. Over the last 10 years, we've distributed over 50,000 devices in all areas of the world, predominantly to community level and mid-level healthcare workers. And this is with the overall aim, really, of trying to reduce this needless disability from vision impairment and hearing impairment through early diagnosis, early management, early referral.
You've been to so many places and you've seen how the Arclight impacts patients and healthcare professionals worldwide. Have there been any surprising or memorable moments in its journey?
You know, with regards to kind of memorable moments, I mean, every day that we do a workshop, there are many memorable moments when a nurse or a clinical officer for the first time sees the back of an eye, sees an optic nerve, sees the retina, sees the blood vessels with the ophthalmoscope. They're very impressed and surprised that they're able to see the back of the eye, and they are great memorable moments and give me a lot of pleasure.
And what's your vision for the future of Arclight and eye care?
Long term, we aim to extend our work throughout all the low and middle income countries in collaboration with the eye and ear NGOs, and you know, pushing with the supranational organisations such as the International Association for Prevention of Blindness and the World Health Organization to try and advocate for extended training and equipping with our frugal technology devices.
And finally, thank you for being with us. Any messages you'd like to share with the young medics and eye care professionals around the world?
And my message to medical students and junior doctors and ear and eye trainees is that the Arclight project tools, both the Arclight device, the direct ophthalmoscope, an otoscope, as well as the binocular indirect ophthalmoscope, Although they are frugally engineered and simplified devices, really they function very well. They are not a compromise. They work very well. In my day-to-day job in NHS Fife, I use the devices, examining 90% of the patients comprehensively with them without having to use a slit lamp or OCT, which I know that is becoming increasingly more common. So I recommend the Arclight project tools to you, and by all means get in touch with us if you wish to become a trainer with us and be involved in training workshops overseas.
If you're a medical student or a doctor, here's the thing. Tools like the Arclight are more than just gadgets. They're mindset shifters. They remind us that our role isn't just to treat, but it's also to understand context, to adapt, and to innovate in ways that actually reach people. There's no use having expensive equipment if you cannot even take it where you need to take it. The impact of Arclight on my own life has been great as well. We're lucky as trainees here in NHS Scotland that we receive our own personal Arclight devices when we get into training. And so I've had the opportunity to use this device in emergency eye clinics, to review patients in the wards, or even if I'm going to see a patient in the emergency department of the hospital. It is an essential component of my own kit for treating patients in the hospital. If you want to try out the Arclight yourself, or you would like to donate to the cause of bringing Arclight to low resource settings, please follow the link in my description where you can buy the device, you can donate to the cause as well. Whether you use it for your own practice or you spread awareness by sharing this video with your colleagues, that ripple effect matters in causing material change in the world to benefit patients and healthcare professionals worldwide. Coming to a close, we often think that the future of medicine is about AI, robotics, billion-dollar startups. But sometimes it's about going small, going simple, going solar, and in doing so, going even further than we imagine. The Arclight reminds me that the most powerful tools in medicine are not always the most expensive. They are the one built with intention, with heart. And so if this moved you, share it. If it inspired you, act on it. And if you're like me, never look at a torch the same way again. Alright, make sure to like this video and subscribe to my channel if you are not already a part of our team here. Leave a comment down in the comments section below if you would like me to address any particular topic. You can see my latest video right about here. And as always, I will see you in the next video.